Syphilis, a sexually transmitted infection caused by the spirochete bacterium treponema pallidum, is the focus of our discussion today. This chapter aims to provide you with a comprehensive understanding of syphilis, including its causes, modes of transmission, and the importance of awareness. Syphilis primarily spreads through sexual contact, including vaginal, anal, and oral sex. The bacteria can enter the body through small tears or breaks in the skin or mucous membranes, making it essential to use protection during sexual activity to minimize the risk of transmission. It's important to note that syphilis can also be transmitted from a pregnant mother to her unborn child, leading to congenital syphilis. Syphilis progresses through distinct stages, each with its own set of symptoms and characteristics. Understanding these stages is essential for recognizing the infection and seeking timely treatment. Let's delve deeper into the stages of syphilis. 1. Primary stage. The primary stage of syphilis typically begins with the appearance of a painless sore or ulcer known as a chancre. This sore develops at the site of infection, which is often the genitals, anus, or mouth. Due to its painless nature, the chancre often goes unnoticed or is mistaken for a harmless bump. The sore is highly contagious and contains a large number of spirochete bacteria. Although the chancre eventually heals on its own within a few weeks, the infection persists and progresses to the next stage if left untreated. 2. Secondary stage. If syphilis remains untreated, it progresses to the secondary stage. This phase usually occurs a few weeks to a few months after the primary stage. The most common symptom of the secondary stage is a rash that can appear on various parts of the body. It may manifest as red or brown sores that are not itchy but can be highly contagious. The rash often affects the palms of the hands and soles of the feet, but it can also spread to other areas. Other symptoms during this stage may include fever, fatigue, swollen lymph nodes, sore throat, muscle aches, and weight loss. These symptoms may come and go over several months, leading some individuals to mistakenly believe that the infection has resolved on its own. However, without appropriate treatment, the infection continues to progress. 3. Latent stage. After the secondary stage, syphilis enters a latent stage. In this stage, there are no visible symptoms, making it challenging to detect the infection without specific laboratory tests. However, the infection remains present in the body and can cause significant damage to various organs, including the heart, blood vessels, brain, and nervous system. The latent stage can last for years, and individuals with latent syphilis can unknowingly transmit the infection to sexual partners during this time. 4. Tertiary stage. In some cases, if syphilis remains untreated for an extended period, it can progress to the tertiary stage. This stage can occur years after the initial infection. At this point, the infection can cause severe complications and organ damage. Tertiary syphilis can manifest in several forms, including neurosyphilis, cardiovascular syphilis, and gummatous syphilis. Neurosyphilis affects the central nervous system and can lead to symptoms such as mental health issues, dementia, and problems with muscle coordination. Cardiovascular syphilis affects the heart and blood vessels, potentially resulting in aneurysms or heart valve damage. Gummatous syphilis causes the formation of soft, tumor-like growths in various tissues, including the skin, bones, and internal organs. Early detection of syphilis is crucial for effective treatment and preventing further complications. Regular screenings, especially for individuals engaging in high-risk behaviors, can help identify syphilis in its early stages when it is most treatable. Testing involves a blood sample or examination of a sample from a sore or rash. To ensure early detection of syphilis, it is important to follow screening recommendations provided by healthcare professionals. These recommendations may vary based on factors such as sexual activity, gender, and overall risk profile. Here are some general guidelines. Routine testing. It is advisable for sexually active individuals to undergo routine syphilis testing, especially if they have multiple sexual partners or engage in high-risk sexual behaviors. This applies to both men and women, regardless of sexual orientation. Pregnant women. Syphilis can be transmitted from a pregnant mother to her unborn child, leading to severe health complications. Therefore, prenatal care includes syphilis screening to identify and treat the infection early, reducing the risk to both the mother and the baby. High-risk populations. Certain groups, such as men who have sex with men, individuals with HIV, and those involved in sex work, are at increased risk of acquiring syphilis. Regular testing is particularly important for these populations to detect and treat the infection promptly. There are several methods used to diagnose syphilis, depending on the stage of the infection and the availability of resources. Common testing methods include blood tests. The most common method for diagnosing syphilis involves a blood test that detects the presence of antibodies against the bacterium treponema pallidum. These tests include the non-treponemal test, such as the rapid plasma Reagan or RPR test, and the treponemal test, such as the treponema pallidum particle agglutination or TPPA test. A combination of these tests is often used to confirm the diagnosis. Dark field microscopy. In the early stages of syphilis, when a chancre or sore is present, a sample from the lesion can be examined under a dark field microscope. This technique allows the visualization of the spirochetes directly, aiding in the diagnosis. Polymerase chain reaction (PCR) testing may be used in specialized laboratories to detect the DNA of treponema pallidum. It is most commonly utilized in cases where other tests have yielded inconclusive results or when testing samples from body fluids other than blood. When it comes to treating syphilis, the good news is that it is a curable infection. The primary treatment for syphilis involves the use of antibiotics, with the specific antibiotic and duration of treatment determined by the stage and severity of the infection. The most commonly used antibiotic for syphilis is penicillin, which is highly effective in eradicating the bacteria responsible for the infection. For individuals diagnosed with primary or secondary syphilis, a single injection of penicillin is often sufficient to clear the infection. The dosage and administration of penicillin will be determined by your healthcare provider, taking into account factors such as your overall health and any potential allergies or sensitivities to antibiotics. It is essential to complete the entire course of antibiotics as prescribed, even if symptoms improve or disappear before the treatment is finished. This is crucial to ensure that all the bacteria are eliminated from your body and to prevent the development of antibiotic resistance. For individuals who have latent syphilis, no visible symptoms, or tertiary syphilis, severe complications resulting from untreated infection, a more extended course of treatment is necessary. This typically involves multiple doses of penicillin administered over a series of weeks. In cases where a patient is allergic to penicillin, alternative antibiotics, such as doxycycline or tetracycline, may be used. However, it's important to note that these alternative antibiotics may be less effective, especially in treating neurosyphilis or late-stage complications. Regular follow-up visits and testing will be scheduled by your healthcare provider to monitor your response to treatment and ensure the infection has been successfully eradicated. If you are diagnosed with syphilis, it is crucial to inform your sexual partners so that they can seek testing and treatment as well. This helps to break the cycle of transmission and prevent reinfection. Additionally, sexual activity should be avoided until both you and your partners have completed treatment and have been deemed non-infectious by your healthcare provider. It's important to note that treatment for syphilis cannot reverse any damage that has already occurred in the body, especially in the later stages of the infection. Therefore, seeking early treatment is vital to prevent the progression of the disease and the development of complications. Remember, your sexual health is an integral part of your overall well-being, so stay informed and take charge of your sexual health. Stay tuned for more valuable tips and information on healthy lifestyle tips.